Hello, my name is Trent Perry. Together with Kyle Thornley, Joshua Burton, and John Nelson, we've created an improved neonatal bronchoscope. Currently, there's a clinical need to provide a better bronchoscope for clinicians to use in small airways. These small airways mean constricted airways, those that are usually found in pediatric patients, and specifically those found in neonatal patients. Poor ventilation in current bronchoscopes leads to decreased SpO2 levels in patients. Bronchoscopies are used to diagnose and treat respiratory problems, and they're used to remove mucus plugs or other obstructions. Improving ventilation techniques during these procedures can maintain patient O2 levels and allow for longer and more complex procedures to be performed. The domestic market for improved bronchoscopes has a lot of potential. Currently, 500,000 bronchoscopies are performed every year, with 100 to 150,000 of those being pediatric bronchoscopies. Every year of the last decade, more bronchoscopies have been performed, showing that this is a growing market. The device provides both a view of the airway and surgical tools to reach the patient through a main tube or pathway. The doctors can also use a telescope to maintain a better view of the airway. We have improved the device by changing the geometry of the intersection, or where the air, tools, light, and telescope intersect. These are all key elements to the procedure, but they limit airflow. We have instead bypassed this intersection and shunted the air directly down the main pathway to the patient. This is a typical device currently used on the market. This is a current device typically used on the market. As you can see, there's a lot of indirect or inefficient airflow. In comparison, our device has very laminar airflow, shunting the air directly down the pathway to the patient. A side-by-side comparison of these two devices shows the air velocity is increased in our device along the main pathway to the patient. It increases airflow by 93% by decreasing turbulence. We've also introduced a telescope adapter to increase airflow. This device moves the telescope from the center to the side by a simple twist. The adapter does not impact the bronchoscope or the telescope. It allows the telescope to be used in a central location, which is beneficial to doctors during certain parts of the procedure, or it can be moved to the side of the bronchoscope to increase airflow. Key features of the telescope include that it will not impact or harm the bronchoscope or telescope, but it will allow the doctors to better utilize the airspace. The telescope adapter increases airflow by 10% and can readily be used with any current bronchoscope on the market. We believe that our innovative designs better meet the needs of the doctors and patients without losing any functionality. It will dramatically increase the airflow. It won't add any mechanical faults or problems to the device. Our current adapter can be used with any tools on the market right now, and our new device can revolutionize neonatal bronchoscopies. We believe that in addition to that, these same principles can be applied in the future to improve airflow to many different types of patients, not just these neonatal patients. Thank you.